Good afternoon, everyone. Um, I would like to thank the organizer for inviting me, and it's my honor to share our experience on PrEP, Chemsex, and STIs in our clinic. So, Chemsex or sexualized drug use among gay men has emerged in around the world. In our region, Asia Pacific areas, um, uh, it's also a common phenomenon. Um, for example, the prevalence is from 5 to 30%. It depends on the methods of sampling. For example, what period of time and whom and which drug you're asking. For example, in Vietnam, they reported almost 14% of MSN use crystal meth during sex in the past 3 months, while in Japan, they reported 11% with any kind of drug use in the past 6 months. So it's quite a little bit different. And in general, people living with HIV report higher prevalence of chemsex. For example, in Taiwan, we reported 30.5% use chemsex compared to 9.3% chemsex use in general MSM. In Australia, the figure is pretty similar. It's 29.7% with chemsex use in the past 12 months among people living with HIV. So we can say that chemsex is common issue globally and also in our region. Because most individuals doing chemsex are using amphetamine type stimulant, mostly crystal meth, being either inhaled or injected or slamming. Along with other central suppressants such as GHB or GBL, they usually have prolonged sexual intercourse with enhanced arousal and also augmented tactile sensation. So people do chemsex are prone to engage in more condyless and anal sex, as well as exposed to different STIs. In our previous studies, working survey done on gay social dating app, we found that people who use chemsex compared to people who don't use chemsex have almost 5 times more chance to have condyless anal sex with men in the past 3 months, and almost 3 times more chance to have any STI diagnosed in the past 12 months. So it's quite important that we look at STIs in our clinic who presented, who told that they're having chemsex. So what's the frequent STIs people having chemsex will have? In our other survey, recruiting people, MSN who do chemsex in the past 12 months, we found that it's not quite uncommon that people actually present with STIs in the past 12 months. The most common STI diagnosed is syphilis. It accounts for 30%. followed by anal warts around 10%, and also gonorrhea 5%, and hepatitis 5%. So it's kind of, so we should be very cautious for people who had chemsex in our clinic, and perhaps we should do more frequent testing, even if they are not symptomatic. So fortunately, not all individuals doing chemsex are not aware of the importance of sexual health. So in the same survey, we realized for those people who do chemsex, and also who are HIV negative or untested for HIV status, quite a proportion of people were actually adopting biomedical prevention, such as post-exposure prophylaxis or pre-exposure prophylaxis. There are 15% of people reported PrEP use, and around 20% of people reported PrEP use, which are actually more common than the MSM in general. So we're going to talk about, demonstrate our case in our clinic. So Mr. C is a 51-year-old single gay man, and he first presented in our clinic for PrEP in June 2019. He actually had a regular HIV testing around once every 3 months. And he actually, for the first time he came to our clinic, he said he actually used condom consistently. He used condom 10 out of 10 times of having anal intercourse. And his last continuous anal sex was more than 2 years ago. He didn't have PrEP before, and he had no history of STIs before. He said he used ecstasy or MDMA and ketamine 10 years ago. He stopped using that. However, he started to use crystal meth and GBL for as chemsex a month ago. So this is why he was told by his partner doing with whom he's doing chemsex to our clinic for PrEP. So before we started PrEP, we did some baseline evaluation. He was negative for HIV or syphilis. He didn't have hepatitis A, B, or C, and he has antibody against Hep A and B. His liver and kidney functions were normal. So so he's eligible to start PrEP. So he actually started daily PrEP because he felt it's easier to remember as a daily schedule. So he came back for follow-up in 3 months. The lab data looks normal, except that the TPIA turned positive, but he didn't complain any symptoms or signs of syphilis. So we scheduled him for another follow-up, and he came back in another 3 months. It's December 2019, and his syphilis was positive with a RPR and a TPLA positive. So we actually asked him to come back for the treatment, but he was reluctant because that was Chinese New Year, and also he was fear of COVID-19 in the hospital. So he came back in March 2020, and of course his syphilis was still positive. So we treated him with 2 weeks of oral doxycycline for early secondary syphilis. He came back in 3 months, and the RPI titer was decreased by 4 times or more. So actually there was the treatment was effective. So he kept PrEP, and he was scheduled to come back in September. But this time he came back with even higher RPR, which is greater than 1 to 64. And also he had abnormal liver function. We checked his anti-HCV antibody and it was negative, but because he had a refunction of syphilis and also abnormal liver function, so we suspect that it might be acute acute HCV infection. So we actually check his HCV viral load, which turned out to be positive. So he was diagnosed with acute HCV infection as long as a reinfection of syphilis. So we treated him again with oral doxycycline and refer him to the hepatologist for possible DAA treatment in the future. Meanwhile, because he has been diagnosed with 2 episodes of syphilis in a very short period of time, so we actually plan to refer him to a psychiatrist, so further Chemsex intervention or harm reduction program. So in conclusions, Chemsex has emerged among MSM universally in different countries in Asia Pacific region. And colon's anal intercourse and recent diagnosed STIs are frequently associated with Chemsex. Reinfection and co-infection of STIs such as syphilis and hepatitis C among gay men having Chemsex is not a common in the clinic. And a substantial proportion of MSM having Chemsex seek for PrEP or PrEP service in the clinic. So this gives us a good opportunity for to screen and treat STIs as well as to implement Chemsex interventions. Thank you.